the microbiome, fecal, stool, or poop transplants with immunotherapy in cancer. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care. There are 3 new studies that were published in Nature, and what they were exploring is the use of immunotherapy incorporating fecal transplants or stool transplants from healthy donors into those receiving immunotherapy with cancer. So there are some Canadian studies, research also out of Italy, and generally speaking, what they were noticing was that there could be some potential improvements in side effect profiles, making treatments work better. There was even some suggestions that maybe like when people are using more than one immunotherapy drug together, they're called checkpoint inhibitors. So say, for example, epilimumab and say nivolumab, there might be a signal of enhanced immune, more toxicity. What's really interesting for me is that being a naturopathic doctor for over 25 years, we are always taught in naturopathic medical school, whenever cases become complex, there was a statement, when in doubt, treat the gut. There were even some of these in-office tests that were done to try to assess, abnormal growth in the bowels and digestion. And so what we're seeing now in the mainstream is people becoming more like naturopathic doctors. And you're starting to see assessments done that when there's maybe more harmful bacteria detected, immunotherapy might not work as well. You're seeing even research suggesting these metabolites that could be signals of poor bowel health could also be a signal of immunotherapy not working. So what it tells me is that should every patient, especially who's receiving immunotherapy, should they consult a naturopathic doctor? Because this is where the research is heading towards. Imagine, now they're talking about giving someone else's stool. I'm a healthy donor that helps to rebalance the bowels, make it more healthy, more diverse, get rid of more potentially more harmful bacterial or overgrowth, and then leading to potentially better tolerance to immunotherapy, potentially greater responses to immunotherapy. So I think, first of all, it's great to see these researchers doing this work. Obviously the data is like phase 1, phase 2 trials, so it's preliminary, sample sizes are small. But nonetheless, it's good to see this exploration in this area, and where we're balancing the microbiome in this way using fecal transplants from healthy people could help to improve immunotherapy responses. There's been also some data with certain probiotics, and there's obviously been discussions of more plant-based diets providing the prebiotics to improve the microbiome and then potentially lead to more outcomes. So I think the whole world now is becoming more and more like a naturopathic physician every day.